And next I introduce, he's a doctor, a famous cardiologist. He was an assistant professor of cardiology in Madras Medical College and professor of cardiology of Ramchandra Medical College and Research Institute during the years 1994 and 2000. And he is having 25 years of teaching practice in cardiology, postdoctorate teaching in cardiology. Now he was having a present positions of consultant cardiologist in City Hospital, Chennai, visiting cardiologist of Apollo Hospital, Vijay Hospital Foundation, Chennai, and Mayo Clinic, visiting cardiologist in England Medical Center. You must think one thing. Being such a big person, he has put his step towards DXN. Why? We have to think. It's a big question. If you think, you'll getting lot of answers for that. And he has a good career achievement when he walked into DXN. He achieved double diamond status in DXN business. He has more than 300 diamonds below. And I call upon the great personality, Dr. Ranjan, to come forward. And I call upon Mr. Haridas to come forward. Give him a good blow. Thank you, Mr. Haridas.
Good morning. So basically, you must be knowing about Ganoderma. All of you are pundits and you must be knowing more than me. I will highlight only certain things which are scientifically proved and how it is going to be useful to all of us. So it's a food supplement, nothing but food supplement. And Hippocrates said in about 450 BC, about 2,500 years back, that food should be your medicine. And that is why in our food we use a lot of these herbs. Inji, manjal, pundu, sukku, melagu, lot of things. So they all have medicinal qualities. That is why ancestors, they have used all these medicinal items as food. And today I think it is apt that we think of this words given by Hippocrates. Hippocrates is an ancient physician we respect the most. And when we get our degree, MBBS degree, we take the oath in the name of Hippocrates, Hippocrates oath, saying that we will be harnessed to our profession and we will sincerely do our profession. And today my lecture is based on that, the food as medicine. The Ganoderma is a food. Please don't use it in any other way. It's a food. It's a superfood which is going to act as medicine. And I always say that all kinds of foods, what we take, can become poison. The water can become, the salt can become a poison, sugar can become a poison, fat, the cholesterol can become a poison. They are all essential for our health and our body and tissues. But they can become poison at some point of time. Even the water can become a poison. Without water, we cannot, any living being cannot be in this world or anywhere in the universe. And for whom the water can be poison, for people with heart failure and kidney failure. And some just before the session was to start, somebody was showing a kidney failure patient's record, and he had a serum creatinine of almost 5.9 or 6 milligrams. For him, salt is a poison. Water is a poison. But Ganoderma, the beauty of Ganoderma is that it can never become a poison. It can only be a medicine. So we'll argue on that. We know that Ganoderma has been there for more than 5,000 years. Chinese have used it for more than 5,000 years. And the active components, more than 200 or 250, it is an increasing list. The alkaloids are very powerful and they have the therapeutic effects. Therapeutic effects means they can address our disease process or any disorder. The ingredients are basically classified into under 5 headings: triterpenes, ganoderic essence, polysaccharides, adenosine, and organic germanium. So I'm not interested in all this chemical structure, the names are, because it will, it's quite complicated and one need not know. But for the sake of, having some information, you should know that there are so many sum fractions which are going to be very useful, and we can discuss that. And to my knowledge, one of the most powerful effect of Ganoderma is the antioxidant effect. Because we talk about the antioxidants, being a cardiologist, the antioxidants, we stress on people taking a lot of these antioxidants in the food. The oxidation process basically, gives us whatever energy, nutrition, what we want. That is why we inhale air, and the oxygen, what we inhale, is used for burning our food, and that is converted into the nutrition. And at the same time, in the chemical process, in the biochemical process, lot of the byproducts, they become toxic to the body, and they are eliminated by the liver and the kidney. And antioxidants have a major role to play by detoxifying those toxic chemical substances and eliminating it from our body. And we know that medical literature says that ginseng is the most powerful antioxidant. And Ganoderma is almost 5 times more potent than ginseng. And how powerful it will be in detoxifying your body. And the American Heart Association recommends the use of antioxidants in food and food supplements to prevent heart disease. And these antioxidants have a major role to play in the prevention of cancer, in the prevention of arthritis, and so many disorders. So the antioxidants play a very major role in our health. And when you take this powerful Ganoderma, you have that protective effect. And one of the substances what we talk about is the free radicals. They are very toxic, and they have to be neutralized, and they have to be eliminated. And the free radicals, the subject is very vast and complex. I'm not going into the basic, the chemical reaction. But this, you should know, these free radicals are very toxic, and they are the byproduct of the oxidation process. And when these free radicals accumulate in our body, it leads to a lot of diseases, especially cancer, arthritis. And the aging process is primarily dependent upon the more and more free radicals making us to age faster. So aging is something which is directly related to disease process. As you age, you get into disease process. That is why we call certain diseases like age-related diseases. Hypertension, diabetes, cancer, stroke, heart failure, renal failure. So age has a direct bearing on the causation of the disease. So when you retard the aging process, then that means you are postponing your disease process. Now the average Indian age is around 60 plus, 64, 65. If you see the developed countries, it is around 80 plus. And in certain countries, people live up to 100, 105, 110, especially, those who are taking this kind of food rich in medicinal value, especially Chinese, the Japanese. They have used Ganoderma for better health, for better longevity. But that is why Ganoderma is called as a herb of longevity. It increases your lifespan. But unfortunately, what is happening is, we get the disease process in the current, the era at the age of 30, 35, 40, 45. People die at young age. I've seen a lot of people getting heart attack at 30, 35. Married 2 years, 3 years down the line, because of whatever reason. Maybe you call it as stress or hypertension or diabetes, smoking. Young people get into heart disease. So that should not be the case. So the Ganoderma has got a very major role to play in the age-related disorders, especially cancer, heart disease, and stroke, and kidney failure, being a powerful antioxidant. So we need to use it as a preventive tool in all these disorders. They are all deadly diseases. So Ganoderma can help you. And the another aspect, a powerful effect of Ganoderma is acting on the immune system, our defense mechanism. And basically, right from childhood, we need that our defense mechanism to be excellent so that we don't get any infections, deadly infections. And Ganoderma has been proved to increase two of the important components of the blood, interleukin 1 and 2 and interferon, so that we can fight against the disease. So all proved research material, whatever I talk. And it can mediate favorably both the humoral and the cell-mediated immunity. And of course, we give a lot of vaccines to prevent many deadly viral infections. And we have eradicated smallpox, now in the process of eradicating polio. It will be a polio-free world in another 5, 10 years or 15 years down the line by 2020, 25. Nobody will have polio. But the sorry state of affairs is that we get newer and newer infections like HIV, hepatitis. We don't know what is going to come in another 5, 10 years, because once our immune system is down, then these infections catch up. And we don't have an answer for HIV now. And that is going to kill a major portion of this population in the world. That is what the scientists have predicted. That is 1/3 of the population will be wiped out by HIV. Another decade or decade and a half. So the situation is very bad. So we need our defense mechanisms to be perfect, and the Ganoderma helps us, especially in children. In children, a lot of children die of ordinary infections. Diarrhea, infantile diarrhea, people die. Children die. Just like, mosquito or a fly, because their defense mechanism is lost, and especially if you have seen the television, they will show, how the African countries, sub-Saharan African countries, their children dying. They are malnourished. So even the slightest infection will kill them. So you don't need a HIV to kill them, virus to kill them. Even the simple diarrhea can kill them. And there, one of the top researchers, he invented a small oral rehydration solution as a treatment to all these children affected with the diarrhea. And he was given a Nobel Prize. He did not discover or invent any of the high-tech gadgets or medication. He just said that you replace the fluid lost by the oral fluid. Oral rehydration solution, therapy. And he was given a Nobel Prize. So, what I'm trying to say is that, the children we need to protect. And they need to have the good defense mechanism, and Ganoderma does that. So, it is said that Ganoderma can be given from womb to tomb. Anybody can take. Such a powerful food supplement which can give. Immune system, it has got a tremendous effect as an immune booster. Then it's an excellent immune modulator, because some of the diseases could be due to the hyperactive immune system, and we call it as autoimmune disease. And there, the Ganoderma has got a major role to play, because it can modify the immune system so that the immune-related disorders can be controlled, especially the classical example being the rheumatoid arthritis. Polyarthritis known as a systemic lupus erythematosus. Somebody was saying about the ulcerative colitis, again an autoimmune disease. Somebody was mentioning about it. He came to my room and he was saying about ulcerative colitis. Again an autoimmune disease. Ganoderma can definitely help. But please don't stop the allopathic medications. They can give you immediate relief. So all the allopathic medications have to be monitored, and that the dosages have to be adjusted according to the physician's advice. Never ever stop any of the medications advised by the doctors in any field of medicine. Let it be Unani, homeopathy, Siddha, or whatever it is. You need that for immediate effect. Ganoderma will do its effect, its goodness only after a period of time. So we need to understand that. And one of the ways that the cancer cells can be killed is by increasing our immune system, defense mechanism against cancer. That's one of the proved the function of Ganoderma. And this is also an important effect that Ganoderma can increase the blood supply to the various organs. You have a very powerful component, the adenosine, which acts as a very powerful vasodilator. Vasodilatation meaning increasing the diameter of the vessel and increasing the blood flow. And if you take most of the diseases which happen in the old age is due to reduction in blood supply. Let it be a decrease in brain function or hearing, speaking, digestion, walking, everything comes down because of reduction of blood supply. And there the adenosine has got a very powerful role to play because it increases the blood flow in the microcirculation, meaning that the blood vessels which are 1/100th thickness of the hair, they play a major role in the blood flow and the perfusion of the every organ and tissue and the cell. So if they are in perfect condition, the blood flow is adequate and all the organ functions are protected. And especially in the old age, it is very important because you need to maintain that. And being a cardiologist, we advise patients to have a good blood flow. How do you do that? There are no specific medications to do that. Maybe we have one or two. For the heart, we have nitrates. For the brain, we have pentoxifylline. And apart from that, I don't think we have enough drugs. There are no drugs for increasing the blood circulation, especially the microcirculation. And especially there is a disease which is called as a microvascular angina. If you do a coronary angiogram, the major vessels will be normal, but the patient will be suffering from the blockages happening in the minor blood vessels, which are the capillaries. You can't do anything. There is no drug. So for them to increase the blood flow, you need a substance like adenosine. This adenosine is naturally present in large quantities. One of the major dietary source of adenosine is Ganoderma. And this adenosine, we use it as an injection now. When I did my DM cardiology in 1985, I never imagined that adenosine will be available as an injection. I never imagined. But today, scientists are able to isolate adenosine and give it as a drug. It's one of the drug of choice for a condition called which is called as a paroxysmal supraventricular tachycardia, where the heart beats very fast. And the American Heart Association recommends that adenosine is the drug of choice. You cannot give any other drug. If you give any other drug for a paroxysmal supraventricular tachycardia, you can be sued in the court of law. Previously, we are giving two drugs. One is verapamil, other drug is diltiazem. You can't give that because they are potentially dangerous. They can stop the heart. They can cause a cardiac arrest. So we don't use that. We do use a powerful drug which is called as adenosine, injection adenosine, again a powerful vasodilator. And here, since it acts on the conduction system, the nervous system of the heart, it is able to arrest the abnormal heart rhythm. The same, the other effect of this adenosine is, I said, the capillary vasodilatation, and that is brought on in the very small blood vessels. And that the effect, we use it for the perfusion scans, the nuclear scans, to study the perfusion of the heart under the gamma camera. So the adenosine is injected, and when the blood vessels are dilated, it gives an assessment of the perfusion, whether the blood supply is adequate, whether the blood vessel is able to respond to the drug. So the adenosine is one of the very powerful agent which is present naturally in Ganoderma. And to give you further information about this adenosine, it's in every cell as a complex, adenosine monophosphate, diphosphate, triphosphate. It's involved in so many enzyme reactions in the form of a cyclic AMP. You need not know all these biochemical substances. It will be little too much, maybe, I'm just mentioning it because, the adenosine is such a powerful molecule and it can give you the protective effect by increasing the blood supply. And this adenosine plays a major role in the capillaries. And when the blood supply is adequate, that means your organ function is normal. And since I said that there is no drug for increasing the blood supply, what the cardiologist normally will do is, we ask you to walk for about 45 minutes. So the benefit of walking is not only to reduce the weight, not only to reduce your blood sugar, not only to reduce your tummy, but it is much more than that. It's much more scientific than that. That means the basic fact is, it increases the blood supply from head to foot. And we measure the cardiac output, the output of the heart in 1 minute as cardiac output, the minute output. It's around 4 liters. When you are sitting like this, your cardiac output may be 4 liters. And after a heavy meal, what happens? Much of the blood is diverted to your stomach and intestine. That is why, when the perfusion is low to your brain, you feel sleepy. So, the cardiac output, 1/3 of the cardiac output is delivered to the liver, 1/3 to the kidney, 1/3 to the brain, only very less to the heart. 60 ml per beat or 40 ml per beat, very less. So, the adenosine is such a wonderful, powerful molecule which is going to help us in protecting the blood flow. So, my message is that, you must walk. When you walk at least 45 minutes, that is 3 to 4 kilometers a day, you are protecting your body, you are protecting your heart, not only your heart, your entire body. So, when you want to protect your health, please walk. Walk for about 45 minutes. That's good. The other effect is, to keep up the microcirculation and to protect them, we give 2 kinds of drugs, clopidogrel and aspirin, so that the blockages, that's a clotting does not happen. And it is said that 1 aspirin a day keeps a heart attack away, because aspirin has got that effect of antiplatelet effect. And platelets are involved in the primarily in the clotting process initially. So that clotting process has to be averted so that you don't get a heart attack or any other blood vessel. And now since adenosine and both these drugs, clopidogrel and aspirin, are very weak antiplatelet drugs. Very weak antiplatelet drugs. Still we use it for whatever benefit it is going to give. And the Ganoderma has got 2 components. One is adenosine, other is guanosine. Both are powerful antiplatelet drugs. So by taking Ganoderma, since adenosine and guanosine is there, you are able to prevent the blood clotting, meaning that you can improve the micro and the macro circulation to all the organs, not only to the heart, to all the organs. The next powerful effect is on the pain and inflammation, pain and swelling. Ganoderma has got that effect because of the powerful effect of the polysaccharides. One of the commonest condition what we get in the old age is arthritis, because we have 240 plus joints. It is certain that all of us will have some form of arthritis as we age. It can affect your knee or ankle or neck or whatever. And what is the answer for that? In allopathy, we give painkillers. What is the other name for all these painkillers? They are all deadly poisons. So please don't take painkillers. They are very dangerous. And now we have the Ganoderma, which is a natural painkiller with safety, absolute safety. And you also know that recently 2 of the drugs are banned. One is nimesulide, other is rofecoxib. I think in India we have not banned. So you still continue to get these painkillers in the pharmacy. People take it and people get into complication, and maybe because of that, the population control can be there. So in many countries, all these painkillers are banned, especially these 2 drugs. And if one of the companies, the very big company, Merck, Merck, it's a German-based company, and they were, I don't know whether we will do it, but they have done it. Because that company was making so much of profit, billions of money on this one drug alone, but yet they decided to close. But we are not even comfortable, banning those drugs. So you should understand how serious it is. And we have a natural painkiller now, Ganoderma, which is able to help us in all these painful disorders, including cancer pain. It can control. But only thing is, it takes time. It takes about 6 weeks or 12 weeks to have that pain-killing effect. But I'm sure that most of us are not willing to wait till such time. And we want our doctors to give painkillers by injection. Immediate relief. Very powerful and dangerous poison by needle. Of course, if the pain is so severe, you have to take it, but please see that you are avoiding all such painkillers. Never take any painkiller without the medical advice. Never. Don't go to a pharmacy and say that you need all these drugs. Give me one nice or Nimulid or all these painkillers. They are very dangerous, and so many pain-killing drugs are under surveillance. They have not approved certain painkillers in US. FDA has not cleared certain drugs. As a trial basis, they have allowed 2 years or 3 years of their use. All this coxib, the rofecoxib, that's banned, then valdicoxib, then so many drugs. So don't use that. You have an excellent natural painkiller. And this anti-inflammatory action of Ganoderma has been found to be effective in controlling 2 of the very bad, very serious brain disorders. One is Alzheimer's, other is Parkinsonism. They are very debilitating chronic diseases. It makes you, very incapacitated. You can't move around, you can't walk, you can't, your mental faculties also affected, especially with Alzheimer's. And in the University of Texas, they have done a study, and they have found that Ganoderma can help in these patients. I have a patient with Parkinsonism who has improved with Ganoderma. Of course, she is on other drugs also, but she has improved. Today morning, she is the bank manager's wife. He called me today morning, and doctor, where are you? Can I come and take RGGL from you? So I said, I'm in Thrissur. I'll come only on Wednesday night. I'll give it to you on Thursday. So I told him, you become a member and you buy the product. He was not willing. I don't know why. So he is my very close friend and very sincere patient, and the Ganoderma is able to help them. And especially in the brain, it does a lot of things, a lot of good things. And we have a neurologist in Chennai who is my student, Arjun Das, Deepak Arjun Das. He prescribes RGGL left and right to all his neurological patients, left and right. He gives a prescription. He is so much convinced about Ganoderma. So, we can't do anything, we don't do anything without evidence. Whatever I talk, it's all based on evidence and research. I cannot talk like a person who is coming on the TV at 10 o'clock in the night or 11 o'clock in the night. You must understand, there is so much of scientific information is available, and it's up to you to know. For that, let the researchers do it. You don't worry about it. You just get the information and convince yourself. You have some basic knowledge about Ganoderma, tell your friends and ask them to use it. That's it. Don't do any research. And the other effect of Ganoderma is this anti-cancer effect. And Japan, they have discovered this in Japan. And Japan is the only country which has declared Ganoderma as an anti-cancer drug. The federal law there in Japan, the drug authorities have said that it is an anti-cancer drug. No other country has declared that. And it can be given to any form of treatment, and the polysaccharide fraction has got the highest effect of this anti-cancer drug, property. And all of you know that cancer is a very deadly disease. It's a death warrant. If somebody, said to have a cancer, diagnosed to have a cancer, it's a death warrant. But at the same time, you should understand that there are certain cancers which can be totally cured. There are certain cancers which can be controlled for 10 years, 15 years, 20 years, 30 years. I can give examples. Prostatic cancer, colonic cancer, breast cancer, some of the leukemias, lymphatic cancers. They have an excellent remission. And my testimonial, my first testimonial was in cancer, a patient suffering from leukemia, monocytic leukemia. It happened in 1999, before the DXN started his business here. And that time Dr. Clarence had come. Dr. Lim sent Clarence to India to open up the market. He tried a couple of times earlier, but he was not successful. And Clarence being Clarence Stanislas, he has done a lot of research in Ganoderma. He is an MBBS doctor. Dr. Ratna's classmate. And Clarence's wife is Dr. Ratna's roommate. And with that, the contact and the friendship, he landed in Chennai. And since Professor Vasupalaya and Dr. Ratna are my great friends, family friends for more than 20 years, I had the introduction of Ganoderma through Dr. Ratna and Vasupal, and Dr. Clarence was giving all this information. So at that point of time when he was narrating all his research work, I thought he is trying to fool me. காதுல பூ சுத்துறான்னு நினைச்சேன். இல்லைன்னா காது குத்துறான்னு சொன்னாங்க இல்லையா. I never believed about Ganoderma. And he gave so much of research material. எல்லாத்தையும் எடுத்து பக்கத்தில் வச்சுட்டேன். Because I was so busy. I get out around 7:30 in the morning and come back around 10 o'clock in the night. Where is the time to read all those things? That point of time only, one of my very close friend, my classmate, my roommate, who is practicing near my house, about 6 kilometers from my house, Velacheri, in Chennai, he called me and said that he calls me Anna. Actually, he is older than me. And I call him Anna. So he said that in the மாதிரி ஒரு patient இருக்கிறாங்க, அவங்களுக்கு blood cancer, monocytic leukemia, proved in Adayar Cancer Institute. She was in very bad state. She was bleeding all over, like, menstruating every day. You can see that, how difficult it is. Bleeding from the nose, from the ears, from the mouth. And she was ஒரு இட்லி கூட சாப்பிட முடியல, கொஞ்ச தூரம் கூட நடக்க முடியல. That's a state, her pathetic state. And when he told me that, what can be done, asked me what can be done, I said, it looks like a very advanced stage. That's what the doctors have said in Adayar Cancer Institute, that she will live only for 2 weeks. The disease has progressed and முத்தின ஸ்டேஜுக்கு போயிடுச்சு, 2 வாரம் தான் இருப்பாங்க. Then I suggested that why can't they at least try the bone marrow transplant. That's one of the accepted treatment modalities for blood cancer. அது சிஎம்சி வெள்ளூரில் தான் பண்ணுவாங்க, வேற எங்கேயும் பண்ணுறதில்ல. That too only 30% success rate, and the money what you have to spend maybe around 10 lakhs, 8 lakhs, 10 lakhs. The patient was very poor. And that point of time only, suddenly it struck me. I said, Anna, இந்த மாதிரி RGGL டாக்டர் ரத்னா ஏதோ சொல்கிறாங்களே, அது என்ன தெரியல, அதை கொடுத்து பாருங்களேன். Then that's a mere an accident, that I told them and told him, and he said, where can it be got? So I said, we have some samples only left by Clarence. That time Clarence was busy, looking for a place for DXN, this T Nagar, the office now. That to one portion only, I think it was initially we took it for rent. And he was doing something, you know, trying to sort of, decorating that and furnishing that and all those things. It was in 99 October, November. Only in 2010 April the business started in Chennai. And I took the products and gave it to my friend, and I asked him to give the products to RGGL to the patient. And she happened to be Tangaraj's patient right from the childhood. So she believed like God, you know, விஷத்தை கொடுத்தா கூட சாப்பிடுவாங்க அந்த மாதிரி பேஷண்ட் அவங்க. She was 25 years, just 25 years, ரஜினின்னு பேர், 25 years. And நான் நிச்சயமா நம்பினேன் 2 வாரத்தில் அவங்க இறந்துருவாங்கன்னு சொல்லு. I believed that she will die, I was sure that she will die within 2 weeks. But something, you know, some miracle happened. That is why, you know, the Ganoderma is called as a miracle herb. The patient called after 2 weeks to Dr. Tangaraj and said that, Doctor, ipo koncham paravalla, I am able to walk up to the toilet. I am able to take 1 idli. And my bleeding has considerably come down. Then immediately, you know, he called me. He was so excited. He called me and so I said, okay, let her go for a routine test and check whether the parameters are getting better, her blood counts and other, you know, the parameters. And to our surprise, you know, the parameters were becoming better. And within 3 months, you know, she was able to become near normal. And after 4, 5, 6 months, you know, she was able to go to work. And that made me think, you know, there is something, you know, very powerful in this, that what Dr. Clarence has given is true. And then I went through the whole literature, and then, you know, of course I didn't have time. I took everything to Dr. Tangaraj, gave it to everything and asked him to read. You read and tell me. And he was experimenting on all patients, people with the asthma, people with allergy, people with hypertension, diabetes, and every day, you know, he used to call. And that patient became better. And we used to sort of, we didn't know any answer for that. And that was my first, you know, the experience with Ganoderma. And even then, I was not totally convinced. And I started reading, and of course, I didn't do much. And that point of time only, the international business coordinator, Ronnie Tan, came. And he had a small meeting, and all of us, about 6, 7 of us, you know, had a small meeting, and he was talking about the business. He was talking only about the business. Only Clarence used to give us a lot of information on RGGL. And he used to say, you know, Doctor, after 3, 4, 5 years, you see how much, you know, the networker will get. Now it's true that, you know, people like Sirajuddin and Sesha, a lot of people are getting a lot of money. We never believed. But we were convinced about the product, and they introduced the RGGL. And it was, in the beginning, you know, there were a few doctors, Ratna, me, and then Dr. Malati and Tangaraj, you know, that is why, you know, a lot of doctors got into DXN business. Otherwise, you know, we are the last people to get into such business. We don't do. So that is the, you know, my attitude, my thinking changed because of this anti-cancer effect. And after that, you know, we have a lot of testimonials, and a lot of people, you must have had a lot of testimonials among yourselves, how it can do good for the cancer patient. But of course, you have to remember that some of the cancers cannot be cured, or, you know, nothing can be done. The disease is so deadly. For that, if you want to give me an example, that's a pancreatic cancer. It's a deadly disease. A person diagnosed to have a pancreatic cancer will die within 6 months to 1.5 years. That's a death warrant. So the cancers behave differently depending upon the cell type, depending upon the stage, and depending upon the differentiation, cell differentiation. So you can't apply a uniform formula or rule for all cancer patients. But definitely for all cancer patients. But definitely a lot of cancer patients can be helped out. But we have to give a mega dosage for them, because the micro quantities the ingredients which are present in micro quantities in Ganoderma will take time to act. And you need to give a very high dosage of about 30 pairs a day. The other day, 2 days back, Mr. Ostler was giving an example about a patient in America taking 90 pairs for 1.5 years, 30 pairs for 1 year and 3 months. She was a patient with breast cancer, never got operated, and she's doing fine. So cancer is such a deadly disease, and in this area we can help them out. Ganoderma has got such a powerful effect. Ganoderma, research on Ganoderma. That's happening in your own God's country. Yeah, in the Thrissur district, Thrissur district, yeah. So what more evidence that you want? But always use it with other drugs, other treatment modalities. Then you can get the best results. Sometimes in many of these diseases, Ganoderma can give you the excellent results or what you may not believe. That is why, as I said, it's called as a miracle herb. Use it, then only you can get the benefit of Ganoderma. Then the other area is the anti-allergic effect. It has got the lenostan, a component which is very powerful in controlling the allergic disorders. Let it be nasal allergy, bronchial allergy, or skin allergy, or whatever it is. It is able to help people with allergic disorders. And in my field, controlling the blood pressure, a very significant effect because it can lower the blood pressure, the ACE inhibiting effect. Now the blood pressure should be only 130/80, not above that. And it can help the weak hearts, heart failure because of the ACE inhibiting effect. It can lower the cholesterol, triglyceride, again a major risk factor for heart disease. And thus it can be a cardioprotective. It can reduce the blood sugar. The Ganoderma A and B which is present there can reduce the blood sugar. And many of us become sweet people after 40, 45, right? So diabetes is very high in our population. So that's a very major problem. And it is said that in another 20 years, 1/3 of the, the Indian population will be a diabetic. Already, the statistics are very high. After the age of 45, 50, 1/3 of the population. And in controlling diabetes, Ganoderma can help being an insulin sensitizer. It can increase the insulin production. It's all well documented now by research. And it can heal the ulcers due to diabetes. And I have found it effective in diabetic neuropathy, one of the conditions where, there are not many drugs. We give usually, drugs like gabapentin, which are highly toxic. And the diabetic neuropathy is a very difficult condition to treat. And my experience is my own mother is taking RGGL for diabetic neuropathy. And she is doing fine. And the only problem I faced is, it took me 3 years to convince my mother. 3 years. So if it happens to me, just, you can think what will happen to you. It's very difficult. So she said, you are an allopathic doctor, why do you want to give this RGGL? I said, it is good, you take it, but, it took me a long time to convince her. She is fine. Now today, she will call me and say that, I've exhausted my RGGL, please send it. So my mother is my client. It can give a lot of benefits to brain and the neurological system. It can increase your memory. Especially in the old age, the loss of memory is very difficult, difficult to treat. And ஞாபக சக்தி, அதை increase பண்ணலாம். It makes you brisk and active. The sleep function is regulated. A lot of people, ஒரு முக்கியமான வியாதி, அதாவது வயதான காலத்தில் என்னன்னாக்க தூக்கம் வரல. அது பல காரணமா இருக்கும். But basically Ganoderma can regulate this because sleep function is a very complicated function. Because the ascending reticular activating system, a very complex system, it has to modulate different neurotransmitters. the signals from the brain, and sleep function can be regulated by taking Ganoderma. And it can increase the spiritual potency. That is why the Buddhist monks, they have been taking it to improve their spiritual potency. That's why it's called as Ganoderma is called as a herb of spiritual potency. Because everything, the activity of the brain is evolved is around the neurochemistry, very powerful amines and neurotransmitters. And Ganoderma has got such ingredients, the alkaloids and other powerful the components which is able to modulate the various brain functions. It's excellent neurotonic. It can be a powerful liver tonic, kidney tonic, brain tonic, and heart tonic, cardiotonic. What is a liver tonic? நம்ம liver tonic ஒன்று பயன்படுத்துகிறோம். அது என்னது? கிளாநெல்லிக்கீரை. ஜாண்டிஸுக்கு அதான் மருந்து இல்லையா? உலகத்தில் வேற எந்த மருந்தும் கிடையாது. இந்த உலகத்தில் எனக்கு தெரிஞ்சு கிளாநெல்லிக்கீரை தவிர வேற லிவர் டானிக் வேற எந்த மருந்தும் கிடையாது. வேற யாருக்கா தெரியுமா? கிளாநெல்லிக்கீரை. That's the only drug. There is no other drug. And lot of drugs for cancers. Cancers are used from the plant kingdom. இந்த நித்திய கல்யாணி இருக்கு இல்லையா, அதுல இருந்து 2 drug. Its botanical name is Vinca rosea, and there are 2 chemical compounds, vincristine and vinblastine, drugs which are derived from that, and we use it as a powerful anti-cancer drugs. நித்திய கல்யாணி எல்லாருக்கும் தெரிஞ்சிருக்கும் இல்லையா, இங்கே கூட நிறைய இருக்கு. வயலட் கலர்ல பூ பூக்கும். அந்த வேர்ல இருந்து அந்த மருந்து தயாரிக்கிறாங்க. வின்கிறிஸ்டின் அண்ட் வின்பிளாஸ்டின். எங்க ஊர் பக்கம்லாம் நிறைய அதை பயிரிட்டு வந்து எக்ஸ்போர்ட்டுக்கு அனுப்புவாங்க. பட் ஐ நெவர் knew that in those days it's used for manufacturing drug for cancer. And lot of drugs in cancer are derived from the plant kingdom, like paclitaxel, daclitaxel. And now as a cardiologist, we quote those drugs basically which are derived from the plant kingdom in the stent. The heart block வந்துருச்சுனாக்க angioplasty பண்ணி ஒரு ஸ்ப்ரிங் மாதிரி ஒன்று இருக்கும், அதை வைப்போம். Stents, highly expensive. The ordinary stent will cost around 30,000 rupees, whereas a drug coated stent will cost 3 times that, 90,000 rupees. Function என்னன்னாக்க அந்த பிளாக் சீக்கிரம் ஆகாது. அதில் ஏன்னா ஸ்டென்ட் வச்சாலும் அதே பிளாக் வரல, அதை கோட் பண்ணுவோம். பேக்லிடாக்சல் கோட்டட் ஸ்டென்ட். அந்த பேக்லிடாக்சல் வந்து மரப்பட்டையிலேருந்து தயாரிக்கக்கூடிய மருந்து, கேன்சருக்கு பயன்படுத்தக்கூடிய மருந்து. The anti-cancer drug coating is given in the stent. So you should understand, in nature there are powerful plants. In the plant kingdom you have such powerful the food supplements which can be used as a drug. அரளி விதையை சாப்பிட்டா என்ன ஆகும்? That's a poison. So and the effect, that's a bad effect. The good effect is that it can control the cancer. It can treat so many ailments. So அந்த மாதிரி நிறைய மருந்து வந்து நாங்கள் வந்து தாவரத்தில் தான் எடுக்கிறோம். அதுக்கு ஒரு மருந்து எங்கள் கார்டியாலஜியில் என்னுடைய ப்ராக்டிஸில் எழுதக்கூடிய மருந்து வந்து டிஜாக்சின்னு. அந்த மருந்து வந்து அன்றாட நான் வந்து பயன்படுத்தக்கூடிய ஒரு மருந்து. இது வந்து சாதாரண ஒரு தாவரத்திலிருந்து கிடைக்கக்கூடிய ஒரு மருந்து 300 வருஷமா தான் யூஸ் பண்ணிட்டு இருக்கிறோம். ஹார்ட் ஃபெயிலியருக்கு இதை விட்டா வேற மருந்தே கிடையாது. there is no drug for heart failure except this digoxin. அந்த காலத்துல டிகாஷனா கொடுத்துட்டு இருந்தாங்க. அப்புறம் வந்து எலிக்ஸரா வந்தது, டிராப்ஸ்ல வந்தது, அப்புறம் டேப்லெட்டா வந்தது, இப்போ இன்ஜெக்ஷனா கிடைக்குது. 300 years there is no other drug for heart failure. இந்த மருந்து வந்துட்டு தாவரத்தில் தான், டிஜிட்டாலிஸ் பர்பியூராலுங்கிற தாவரத்தில் தான் கிடைக்குது. இன்ஜெக்ஷன் பெனிசிலின் காலால தான் கிடைக்குது. அதை கண்டுபிடிச்சவருக்கு நோபல் பிரைஸ் கொடுத்தாங்களா? சர் அலெக்சாண்டர் ஃப்ளமிங். அண்ட் தட் இஸ் தி ஆன்டிபயோட்டிக் வாட் வி யூஸ் டு ப்ரிவென்ட் ருமேட்டிக் ஃபீவர் இன் சில்ட்ரன். இந்த ருமேட்டிக் ஃபீவர் அப்படின்னாக்கா கால் வீக்கம், முட்டி வீக்கம் வந்து ஹார்ட்ல இருக்கக்கூடிய வேல்வை பாதிச்சிடும். அது லீக் ஆகும், இல்லைனாக்கா அடைப்பட்டு போகும். ஸோ இட்ஸ் எ மேஜர் ப்ராப்ளம். ஸோ ஒன்லி இன்ஜெக்ஷன் பெனிஸ் கேன் ப்ரொடெக்ட். ஸோ கொஞ்சம் சிந்திச்சு பார்க்கணும். நேச்சர்ல இருந்து நிறைய நமக்கு ட்ரக்ஸ் அலோபதியில் யூஸ் பண்ணுறோம். And recently I read an article about last week, and they have done a study. Whatever the new molecules or drugs what they have discovered in the past 40 years, 50 years, and they have analyzed and they have said almost 67% of the drugs are derived from nature, not by chemical processing, from nature. So people have known this Ganoderma, especially the Chinese and the Japanese, about this Ganoderma. They have used it 5,000 years back. And the scientific information was lacking. Now we know for the past 30 years there is a lot of scientific information, research material about Ganoderma, and you can go through that from different sources. And it can an excellent got a detoxification function, and it will help our kidney and liver to neutralize, eliminate all those toxins. It neutralizes all the toxins, just like as I mentioned earlier, the free radicals. And when these toxic substances are eliminated, our health is protected. ஏன்னா எந்த அளவுக்கு இன்னைக்கு வந்து டாக்ஸின்ஸ் எல்லாம் இருக்காங்கனாக்கா அந்த தண்ணியில கூட இருக்குது, ட்ரேஸ்ல இருக்கு, பெஸ்டிசைட்ஸ், தென் மென்யூர், கெமிக்கல்ஸ், வாட் எவர். ஸோ அதெல்லாம் நம்ம சாப்பிட்டு இருக்கோம் நம்மளுடைய உணவில், அதாவது காய்கறியில், பழங்கள்ல. All these chemicals we are taking, so they become very toxic and they produce a lot of these diseases. So the basic effect of Ganoderma is to neutralize them and to eliminate them. So when they are eliminated, the health is protected. And here especially it can regulate the hormonal levels. பண்ணதுனால இந்த குழந்தை இல்லாதவங்களுக்கு இந்த ஹார்மோன் டிஸ்டர்பன்ஸ்னால குழந்தை இல்லைனாக்க you may be able to get children. There are a lot of Gano babies using this Ganoderma. So Rishi is an excellent regulator. And the regeneration function, ஒரு 10 வருஷம் அந்த RGGL சாப்பிட்டா இந்த எஃபெக்ட் வரும்ன்றாங்க. You can regenerate your cells. Old ageல you lose lot of cells. That's one of the reasons for aging process. ஏன்னா நம்ம உடம்புல வந்து 8,000 crore cells இருக்கு. அந்த செல்ஸ் எல்லாம் கொஞ்சம் கொஞ்சமா நம்ம இழக்கிறப்போ we become aged every day. ஸோ அதை வந்து ரீப்ளேஸ் பண்ண முடியாதனால தான் நிறைய நமக்கு வந்து நம்ம ஃபங்க்ஷன்லாம் வந்து கம்மியாகுது. ஸோ by taking Ganoderma, you can have this regeneration function. That is scientifically proved, how it can regrow the axonal nerve cells, that they have proved. So the Ganoderma can do that. By improving the regeneration function, it can give you a better health. And now the current the terminology is used as Ganoderma as an excellent adaptogen, number 1 adaptogen. The adaptogen concept சொன்னவருக்கு வந்து நோபல் பிரைஸ் கொடுத்தாங்க. So he says an adaptogen is one which is non-toxic, non-specific, and has got an overall normalizing effect. And this is one of the theories, and it is well accepted, and he was given a Nobel Prize. And Ganoderma exemplifies as a classical adaptogen, and it's called as the number 1 adaptogen in the world. And being a heart specialist, it helps the heart in many ways. எல்லாம் இண்டிவிஜுவலாக எஃபெக்ட் சொன்னேன். எப்படி அந்த ரிஸ்க் ஃபேக்டர், blood pressure, high blood sugar and cholesterol, these are the major risk factors for heart disease. It is able to address that. And secondly, it can improve the blood circulation by vasodilation and by this antiplatelet effect. And it can control the blood pressure and help the heart ACE inhibiting effect, the pumping function. And it is an anti-stress herb. Now, one of the other major risk factor for heart disease is stress. Stress is very bad. It can kill you. And especially with reference to heart, the stress can cause heart attack. And the Ganoderma can act as an anti-stress herb because it acts on the brain and the subcortical centers, that it can modulate your stress level. And that is how people have used it for improving the spiritual activity. And in my opinion, I am very sure that Rishi is a very powerful heart tonic, cardiotonic, because of these multiple effects. And RGGL பத்தி ஜாஸ்தி பேச வேணாம்னு நினைக்கிறேன். The dose எல்லாம் I think everybody will know. And only with only one இது என்னன்னாக்க I'll talk about this GL Ganoderma சொல்லிட்டு அந்த வேர் பகுதியிலிருந்து கொடுக்குறாங்க. அதில் வந்து தி கண்டெய்ன்ஸ் high concentration of organic germanium and polysaccharides, so that it's good for children. And in the shiitake mushroom, which is added to this RG powder, it has got lentinan, which has got multiple effects. It can act as an anti-cancer, immunostimulating, and it can help you in very many ways. These two are the very important effect of Ganoderma, so that it will increase the effectiveness of the RG. This is a usual dosage what we give. And to make it simple, the healthy people, two categories we can divide. One with the disease, another with the no disease. Healthy people, they can take 1 to 2 pairs, and unhealthy people, you need to give them a higher dosage, because the micro quantities which are present in Ganoderma, they have to get into our body and they should produce the desired result. So it takes little time, maybe about 6 weeks to 12 weeks, because Ganoderma cannot be given as injection. You have to take it. It's all the components are in micro quantities. And some of the diseases you have to give mega dose, high dose, especially in cancer, severe arthritis, you can go for a higher dose. And in any form of treatment, diet plays a major role. And Ganoderma, being a very excellent diet, food, with the unique property of having all this therapeutic value, it will help. But the only thing is, it will not address any mechanical problems like hole in the heart, hernia. It will not address anything related to body chemistry. It will be able to modulate that and give you a better health. And what are drugs? The drugs what we use in allopathy are poisons. They are highly poisonous. அதுக்காக தான் நாங்கள் படிக்கிறோம், 6 வருஷம் படிக்கிறோம், வியாதியை பற்றி படிக்கிறோம், பாய்சனை பற்றி படிக்கிறோம். அதுக்கப்புறம் தான் அது எவ்வளவு கொடுக்கணுங்கிறத தெரிஞ்சுக்கிட்டு படிக்கிறோம், ஃபார்மகாலஜி. அதுக்கு மேலே we read மெடிசின் மாஸ்டர் டிகிரி. தென் அதுக்கு மேலே ரொம்ப தலைகீழ படிச்சுனாக்கா அந்த டிகிரியை மாற்றி போட்டுருங்க, டிஎம் கார்டியாலஜி. ஸோ அது மாதிரி அந்த ட்ரக்ஸ் எல்லாம் பாய்சனஸ். ஸோ அதுக்காக தான் இப்போ அந்த பாய்சனை டீல் பண்ணுறதுக்கு எங்களுக்கு டிகிரி அங்கீகாரம் கொடுக்குறாங்க. இப்போ எலக்ட்ரிசிட்டியிலலாம் இது பண்ணுறதுக்கு யூ நீட் அ லைசன்ஸ் இல்லையா? இல்லைன்னா என்ன ஆகும்? யூ கெட் அ ஷாக் அண்ட் யூ வில் பி டெட். ஸோ வி நோ ஹவு டு ஹேண்டில் ட்ரக்ஸ், ஆல் திஸ் very powerful toxic chemicals. So let us not go into this area. That leave it to us. You don't try to become a doctor. You try to become a person who will promote health. Nothing but health. இப்போ டாக்டருங்கிற முறையில் வந்து எங்களுக்கு யாராவது ஹெல்த்தியாக இருக்கிறவங்க என்ன வந்து பார்ப்பாங்களா? ஹெல்த்தி யாராவது இருக்கிறவங்க என்ன வந்து பார்ப்பாங்களா? பைத்தியக்காரன் தான் வந்து பார்ப்பான். ஸோ வியாதி வந்ததுக்கு அப்புறம் தான் the doctor comes into the picture. But anybody can do a health advice. You don't need a doctor to do that. Anybody can do that. So I think in that sense, I think all of you can be health promoters. Please don't become doctors. And if you want any of this information, whatever I have spoken, it's all available to you in these websites. ஸோ என்ன வந்து கேள்வி கேட்காதீங்க, இந்த வியாதி கொடுக்கலாமா அந்த வியாதி கொடுக்கலாமா அப்படின்னு கேள்வி கேட்க வேண்டிய அவசியமே இல்லை. டோஸும் கேட்க வேண்டிய அவசியமே இல்லை. எவ்வளோ முடியுமோ சாப்பிட சொல்லுங்க, அவ்வளோதான். பர்ஸு மட்டும் கொஞ்சம் கனமாக இருக்காருன்னு பார்த்துங்க. ஸோ ஆல் whatever the information I got it through these major websites, especially when you go to the website Gyanotherapy USA, you get everything. ஸோ நான் சொன்னதெல்லாம் டாக்டருங்க முறையில் நான் சொல்லியிருக்கேன். எனக்கு கொஞ்சம் அதிகமாக தெரியுதுங்கிறதுனால இதை சொல்லியிருக்கிறேன். ஐ டோன்ட் வாண்ட் டு பி அ ரிசர்ச் பர்சன். ஸோ ப்ளீஸ் டோன்ட் டூ எனி ரிசர்ச் ஆன் Ganoderma. ஆல்ரெடி தட் இஸ் அவைலபிள். அண்ட் whenever you want a higher information, one is interested, go and read. ஆனால் சில பேரை பார்த்துருக்குறேன், எல்லாம் தெரிஞ்சுக்கிட்டு தான் இதை வந்து ரெக்கமெண்ட் பண்ணுவேன்னு. அது எப்போவும் நடக்க போகிறதில்ல. ஸோ அந்த மாதிரி கேட்குறவங்கள நீங்கள் மறந்துடுங்க. they will not build a business or they will not use the product also. We don't need them. சில கேரக்டர்ஸ் இருக்கிறாங்க. ஸோ நானே வந்துட்டு என்னுடைய கொலீக்ஸ் நிறைய சொல்கிறப்போ அவங்க கேட்க மாட்டாங்க. யூஸ்வலாக எப்படி இருப்பாங்கன்னா இந்த குதிரைக்கு கடுவாலம் போட்ட மாதிரி. ஸோ எங்கள் டாக்டர்ஸ் எல்லாம் வந்துட்டு they will have only one vision. And a patient comes to us, I'll think, can I do an angiogram, can I do a plasty, can I do a surgery and get my fee, 10,000, 20,000, 30,000. So they won't do it. So they won't have that open mind. The open mind இருக்கிறவங்கள நீங்க வந்து you talk to them about the products, give them the benefits, how the Ganoderma can help them. I'm not going to all these things. So whatever I have given, I think I thought that I can finish early, but I have taken a little more because you were all little patient in listening to me, so that I have extended my time, because I wanted to be very short, because next Osler is going to give his presentation. I always quote Swami Vivekananda. Wisdom lies not in the amount of knowledge acquired, but in the degree of application. நம்ம எவ்வளவு தெரியும்னு அவசியம் இல்லை, நிறைய தெரியணும்னு அவசியம் இல்லை, எவ்வளவு தெரியுங்கிற அந்த இது நமக்கு தேவையில்லை. என்ன தெரியுமோ அதை அடுத்தவங்களுக்கு சொல்லணும். ஸோ வாட் எவர் லிட்டில் இன்ஃபர்மேஷன், குட் இன்ஃபர்மேஷன் தட் ஸோ அந்த வகையில் வாட் எவர் லிட்டில் ஐ நோ அபவுட் Ganoderma, I have presented to you. I am not a Pandit or a research scholar in Ganoderma. I am an allopathic practitioner, and I know only very little about Ganoderma. I know that you are all Pandits in Ganoderma, so please don't ask me any questions about Ganoderma. And I always believed in this, that is, you have to do hard work. That is what my parents taught me. That is what my father taught me, that I should do hard work. Because he was a great man, he was a great physician, he was a cardiologist. So I wanted to become a cardiologist like him. Then what is the answer? I have to work hard, I have to study hard, I have to at least become 1% of my father. So I did that. And this man, a great man, Thomas Alva Edison, who is a inventor of more than 1,000 inventions. And he has said, I had the opportunity to visit his lab in Florida, Fort Myers. And there, in the souvenir, they have a souvenir, these words are written. I have one. And he says, a genius is one with 1% inspiration and 99% perspiration. பண்ணணும்னு என்ன இருந்தா போதும், அதை செயல்படுத்தணும். You must do hard work. எந்த பிசினஸ்ல, இந்த டிஎக்ஸ்என் பிசினஸ் எந்த துறையா இருந்தாலும் you have to do hard work. ஒரு பெட்டி கடை வச்சா கூட you have to be working hard. நீங்க பெட்டி கடையை வச்சுட்டு நீங்க ஆள் இல்லைனாக்கா அப்புறம் கடையே இல்லாத போயிடும். So you have to do hard work. You have to spend time. அதனால தான் சிராஜுதீனோ, ஷேர்ஷாவோ, இல்லை பெனீஷோ, இல்லை பிஆர் ரஜியோ, they have done that. I am not able to invest time like Sirajuddin, because I have to invest my time in my profession. I have become a cardiologist because out of my commitment. My dream was to become a cardiologist, so I can never give up my profession. That's what I was telling Mr. Osler, I'll never give up my profession. I love my profession, because whatever I am today, I am because of my profession, medical profession, being a cardiologist. I have seen a lot of big guys. I have been physicians to a lot of VVIPs, including 2 former presidents of India. That status my profession has given. That is for my sincere hard work. That's for my sincere hard work and honesty, what I practice in my field. So in DXN also, if you are hardworking, if you are sincere, if you invest time, you can get whatever you want. That is what I understood. But unfortunately, I am not able to get involved full time, like Mr. Osler, like Sirajuddin. I think I cannot ask for more than this. So whatever little amount of time that I have got, I have become a double diamond. So maybe that I can achieve a little more, and I want to get more free time. ஏன்னா இன்னைக்கு திருச்சூர் நான் இங்கே வந்திருக்கேன்னா I have to do a lot of my homework in adjusting my appointments and Already 2 of my patients are operated in Apollo, and they'll be wondering where this guy has gone. Where the hell this guy has gone? Of course, he'll be in the post-op room. So it's my duty that I should look after my patients. Because avanga heart engata opadaikiranga illaya. Of course, I have my colleagues to take care. I have an excellent colleague, surgical colleague who will take care. I have 200% confident in him. So when Guptaji and Sunil wanted me to come here, I said, okay, it may be a little difficult, but the pressure was too much that I had to yield. And I also told them that I'll get back tonight or tomorrow morning. So they said, no, they booked it for tomorrow night. Today also Sunil was asking me whether I need to go tomorrow morning. I said, okay. Anyhow, I have done, one mistake of, postponing my trip. Let it be only one mistake. I'll go tomorrow night. So I think I have given you some information and some useful information. I want you to think. And whatever information that you want, it's all available in black and white in various sources. So I thank you very much for your patient listening. And when there is another opportunity, definitely I will come back to you. And especially with the Kerala, I have been associated little more than the others because Professor always, Vaspali always insisted that I should come. When the Kerala market was coming down, I had traveled a lot of times, right from Trivandrum to other places. And I know how sincere the Kerala leaders are and how they have grown up. And you must all follow and emulate people like P.R. Rajiv, Sirajuddin, and Sher. A lot of leaders here. They're all, people with coming from simple background, not much of an education, like me or Mr. Osler or anybody, but they have achieved. And if they have achieved, I think all of us can achieve. So with that word, I take leave. Thank you very much.
Thank you, sir. Thank you very much for your good presentation.